music, and mental health. All right, y'all. So in this installment of Music and Mental Health, we're going to talk about dynamics. Or dynamics. Pick your poison. So dynamics are all about, I'm going to refer to Dr. Google, because remember, Dr. Google knows all things music. I should say accompanist or a pianist or contralto Google. There you go. In music, the dynamics of a piece is the variation in loudness between notes or phrases. Dynamics are indicated by specific musical notation, often in some detail. And y'all, it really is. So if you have ever read music, the composer or arranger person is constantly telling you how loud or soft to make things, like literally all the time. They even use little marks like, not plus signs, greater than or less than signs to tell you how to do it. And so, and that's what makes a piece, again, it gives it richness and flavor. And oftentimes they intertwine that with your dynamics and your accent, your timbre and your accent. So make sure you watch our other videos because I explain all that stuff. Well, when it comes to your practice, so if you are in practice as a therapist, the dynamics of your practice matter. Sometimes you're going to be very much in your face. You're out saying, hey, I'm taking new clients and taking new patients and I'm doing this and I'm on TV and doing all this stuff. And then there are going to be other times where you actually need to be very soft and quiet, most times in a session itself. And making sure you modulate those things can be difficult, right? So if you are really loud in session, you may actually disrupt or worse, cause some distress to the person that you're working with. Whereas when you're out marketing your practice and letting people know what you're doing, if you're very quiet, then you may not get above the din that is the chaos of the world, because there's always people doing something, screaming about something. And then same thing for patients and clients. So if you're in therapy, knowing when to speak up, knowing when to maybe not speak so loudly, being kind to yourself, knowing when to speak loudly to yourself, and knowing when to not speak so loudly to yourself. All of those dynamics, that give and take and that push and pull, really, really important to have a very robust therapeutic experience. And so whether it's music or mental health, all these things go together.